Hey guys, it's Sarah. For my aesthetic project, I decided to record a few important people in my life and have them share their stories, whether it's with good or bad nurses, so that we as nursing students can take what they've learned and what they've experienced and take it with us through the rest of our journey, and hopefully we can do the same good things or we can learn from the bad nurses' mistakes. At the end of the video, we'll kind of talk and discuss the class concepts that we've learned throughout the course and how it applies to the individuals in this video. Anyways, it's been a blessing and an honor to get to know every single one of you guys this semester. I can't wait to continue to get to know you guys and experience this nursing journey with you throughout the next couple years. So thank you, Professor Davis, and without further ado, here is my project.
Hi, I'm Janice Stahl. So I was being treated for skin cancer with a drug called Picado, and they told me to put it on my face for 3 consecutive days, 1 time each night. And I read all of the indications on the drug, and it told me if I had any burning or blistering to call the doctor immediately. So the days that I happened to start were Friday, Saturday, and Sunday. So I put the drug on Friday night, and everything went fine. I put the drug on Saturday night, and I woke up Sunday morning, and I had blistering all over my face. And so, okay, it's Sunday, and so I don't want to call the doctor, but so I don't. So I just stop. But by Sunday night, I had this extreme, excruciating pain in my eye, particularly my left eye. And so I went to the emergency room, and the doctors in the emergency room told me that I had burns over both my corneas. What I want to talk to you about is the reaction that I got from the nurse and the dermatology doctor. So I talked to the nurse, and she told me that the reaction that I had was normal, that blistering was normal, despite the fact that I had brought the paperwork that told me that blistering was abnormal in the drug. She told me that it was absolutely normal. I told her I had burns on both my corneas, and she told me not to worry about it, even though I'm showing her the paperwork. And I told her that I had been to the eye doctor twice and that I had burns across my corneas. She said not to worry about it, that everything was going to be fine. Subsequently, I found out that the drug had been reported to the FDA for exactly those reactions. I found out that she had not put that into my record for the doctor to know that that was happening. She did not work with my eye doctor. I had subsequently 9 appointments with the eye doctor to get my eyes treated for that reaction. And so to me, that's not good treatment by a nurse. And having such good treatment usually by nurses, I know that that's not the reaction that I expect from a nurse.
Hi, I'm Bill Mertens. My daughter Sarah asked me to relay an experience that I've had with nurses. Thought about it for a while and decided probably the most significant one for me was my experience with nurses as a family member rather than as a patient. My mom was diagnosed with ovarian cancer and had a long 7-year battle with it, a lot of chemotherapy, a lot of surgeries, and a lot of illness, and also a lot of good times, but it got to the point where there wasn't anything else to do, so she chose to go to inpatient hospice. So she was in hospice being cared for by a lot of people, the most important of which were nurses, for 32 days. A couple of the characteristics that stood out for me watching the nurses was their competence and knowledge in medicine, and they all displayed that. So they all knew what they were doing, which was very important. But they went beyond that, and they got to know Mom personally. They built relationships with her, which I think enabled them to anticipate her needs and give her the most care and comfort during probably the most difficult time in anybody's life, the end of life. So one of the things that did for us as family members that spent a lot of time there was it gave us, watching the nurse's interaction with Mom gave us the confidence to be able to go home and get some sleep at night, which happens sometimes. And it was really cool to watch the nurses express a respect and a love for my mother as a person, not just as another one of their patients. It was very personal. Another thing they did for us as family members was provided a lot of counseling and comfort for us, helping us to understand the process of passing away and what we might expect and what could happen. And I know all experiences are unique, but they were able to provide us with kind of a rough path on what the future held, and it really helped us transition through that period easier. So after she'd been there more than a month, the doctors assessed her and told us that she was still pretty strong and probably would survive a while longer. At that point she was on pretty strong pain medication, so there wasn't a lot of direct communication with her. So our communication was mostly through the nurses. So the day before Mom passed away, the doctors had told us that she probably has a week or more. But the nurses told us that her journey was almost over, and we had built a lot of confidence in them. It wasn't like there was anything wrong with the doctor's assessment. It's just the nurses spent so much time with people and had so many experiences that they actually had a better feel for what was probably going to be next. So it was that night around 2 or 3 in the morning that the nurses called us and said that she was close. So we went down right away to be with her, and she passed away that afternoon. And her passing was peaceful, without pain, without fear, and all of us knew what to anticipate and were very grateful for the nurses' help in that process. And after she passed away, the nurses kind of took control of providing us the support and also the privacy to say our final goodbyes. And they all came through and expressed their sympathy and their love and respect for my mom. So I guess the bottom line is that for me, nurses are critical in treatment of people. Obviously you still need doctors to do surgeries and diagnosis and that kind of thing, but the hands-on care and love and respect that nurses show made all the difference, at least in this instance, for me and for my family. So I guess the final thought I'd leave you with is that I would rank nursing very high on the list of the most important and impactful jobs that there is.
Hello there, my name is Darlene Hooper, and I'm a grandmother to Sarah Mertens. I wanted to share with you my experience with my heart attack. We were scheduled to fly, early flight, to Denver to attend a funeral of one of my relatives. As we boarded, I suddenly became nauseous and was concerned that they were going to not let me fly. But I did reach Denver, and we didn't return to Phoenix until Sunday evening. Monday morning, I was still ill, not able to keep anything down, and just feeling rotten. I called the doctor. He said to get to the emergency room immediately, which I did. And after running tests and everything, they told me the shocking news that I was having a heart attack, and it had started on Friday evening. Well, I just could hardly believe it, but That's what they said. So they encouraged me to go to surgery immediately. So I met this very nice, kind nurse, and she said she would be with me and take me to surgery. So as we proceeded down the hallway, she said, "Mrs. Hooper, would you like me to pray with you?" And I said, "Of course." And she did. She was wonderful, helped me to relax, and I got through the surgery just fine. And she attended me all the while I was in the hospital. I had a totally blocked coronary artery, which they put a stent in, and I was her patient, and she just met my every need. She shared with me that she was a traveling nurse, and I had not heard of such a thing, but she was there for a period of 6 months, and this was at Chandler Regional Hospital in Phoenix, Arizona. And I'll never forget her because she helped me when I was a very scary time in my life. As it turned out, everything went well, and I am doing well.
I can only imagine what it will be like when I walk by your side. I can only imagine what my eyes will see when your face is before me. I can only imagine. Surrounded by your glory, what will my heart feel? Will I dance for you, Jesus? Or in awe of you be still? Will I stand in your presence? Or to my knees will I fall? Will I sing hallelujah? Will I be able to speak at all? I can only imagine. I can only imagine. I can only imagine when that day comes and I find myself standing in the sun. I can only imagine when all I would do is forever, forever worship you.